Welcome to the ResearchWorks podcast, broadcasting live from the Oceania Academy of Cerebral Palsy and Other Childhood Onset Disabilities Conference 2026 in the beautiful city of Hobart, Australia. Join Dr. Dana Poole and the ResearchWorks team as we bring you an exclusive series of interviews with visionary keynote speakers and leading presenters, captured right here amid the groundbreaking discussions and innovations shaping the future of disability research and care.
Good morning and welcome back, everyone. It's ResearchWorks podcast here at Oceania Academy 2026, Hobart, Tasmania, Australia. It's about to be morning tea time again. Marissa, have you had a chance to have any morning tea during this conference?
No, I didn't. I didn't have a coffee till 2:00 yesterday afternoon, which for me is very late, but I am operating on Perth time. So,
did you have a headache or were you okay?
Look, I think because I was on Perth time, I was okay. But today I think things are going to have to change. I'll grab one after.
You'll grab one. Yeah. I've been looking at cookies and I'm like, someone save me a cookie. And then I forget about it. They look really good. Anyway, we have been having great conversations and this one we've been so looking forward to. We actually spoke to our guest who we have here in our first season, Rachel Byrne. Welcome back to the podcast and thank you for being here and saying yes even in the first season when you didn't know who we were.
Of course. You know, I love ResearchWorks and I love everything that you're doing. And I think it's wonderful for the community to have somewhere to be able to share all the work that's going on and everything that's happening.
It's so good. And it comes from the generosity of so many incredible speakers, people who are passionate about the area just like you. And I've been following your work over these last few years and it's been wonderful that we're sort of now on a similar grant together so I can hear more about the work that you do. And we thought, there's a lot to share. And what you spoke about last year at a meeting that I went to really just kind of went, it was very much mind blown in terms of where we stand and the vision. So let's start with a little bit about you, because I think that's really interesting in terms of what you do, Rachel.
Sure.
So you at the CP Foundation, what is your role and what do you do?
Yeah, sure. So I am the Executive Director at the Cerebral Palsy Foundation. And the Cerebral Palsy Foundation is a not-for-profit based out of New York City. So a bit confusing for those listening because you're probably hearing an Australian accent. However, and with that, like the goal has been to be a catalyst to drive positive change for the 50 million people living with cerebral palsy around the world.
Wow.
Right. So as a mission, it's pretty broad. And how we achieve that is through different things, whether it be through creating research pathways, clinical implementation frameworks, advocacy and policy, which hopefully we'll talk a little bit about today, because I think that is such a collective effort that needs to get done. And then around knowledge translation and dissemination, because, you know, there's no point in doing all of this work if no one hears about it.
That's right.
Which is also wonderful why ResearchWorks is so great. From a clinical background, I'm a physiotherapist. So, you know, it's always sort of been embedded in everything that I do.
Yeah.
That there's this sort of clinical approach sometimes and obviously family-centered. You know, the families are at the heart, adults with CP are at the heart of what we do at the foundation. And so, yeah, we do a lot, but I think the exciting part, though, is actually to see how much the field and the sector is coming together and moving forward.
Yes.
I loved hearing you talk yesterday and sharing more of your vision and I guess especially with your role, but just to bring together all these different working groups across the world. Like you said, you have this passion for global advocacy and just to bring more equity and equality and really raise the profile of what it is to have cerebral palsy so we can have better outcomes. And
you know, one of the things with cerebral palsy is, and even being it here during these last couple of days, it's just extraordinary the amount of work that's going on.
Yes.
You know, and that is happening globally and it's happening at local institutions, it's happening by therapists, it's happening by obviously physicians and researchers. But a lot of the time, you know, we end up talking amongst ourselves because it is a pretty niche and very specific area.
Yeah.
Apart from it's not rare with 50 million people around the world obviously having it.
Yeah.
But what we need to do is, okay, how do we elevate this message? How do we make sure that people know that actually cerebral palsy still is an urgent public healthcare issue?
Yeah.
How do we let them know that actually while there's been advancements, we're still at this incremental stage? And how do we actually make sure that cerebral palsy then ends up on the same pipeline and pathways as other developmental disabilities or diseases who have been able to really, I think, coalesce and come together cohesively to, you know, accelerate these things?
And what are the challenges about cerebral palsy that make it so unique when it comes to this advocacy piece? Because for a lot of us listening, this is our everyday. You know, we are in the lives of many people with cerebral palsy, and we think that it's an issue that everyone knows about. But there's another side to that, isn't there?
Yeah, absolutely. Yeah. You know, sometimes it comes down to the basics, like what is cerebral palsy? And even as a sector and a community, sometimes we're not very good at explaining what cerebral palsy is.
Yeah.
You know, do we all say it is the most common lifelong disability that started in childhood? Probably not. No. A lot of the time, sometimes we still say it's the most common childhood physical disability.
Yeah.
Right? And those word choices matter.
They do. Yeah.
It's also because when you've met one person with cerebral palsy, you've met one person with CP, right?
That's
like
true.
We know the heterogeneity of CP. While that makes it obviously extraordinary to think about how to look at interventions, it also makes it extremely hard for others to understand.
Right.
And, you know, one of the pieces that I've realized in the last couple of years when we've really started to do more effort, say, at the WHO and global areas, is that cerebral palsy doesn't have a home.
See, that feels really shocking to me.
Because we don't have a home because we belong everywhere.
Yeah.
So if we're thinking about, you know, WHO, for example, we go, okay, cerebral palsy could belong in infant maternal health. Absolutely. I don't think any of us would disagree with that.
Yeah.
It could also belong in brain health. It could also belong in rehabilitation. It could also belong in disability.
Of course.
And they're just some examples, right? And so you go, okay, if you belong in all of those in a system that hasn't really been built to work across all of them, it makes it really hard. So we actually just end up falling through the gaps.
And when you say that, I was just thinking it's not only even healthcare, it's even as they go into adulthood, things like access to employment.
Absolutely.
You know, and more, I know one of the big things is about advocacy and teaching them to advocate as well for themselves. But it's just there's so many barriers that can come from that.
Yeah, you know, it's just that whole feeling of because you belong everywhere, you belong nowhere.
That is absolutely true.
And it's this piece of going, okay, well, how do we find our home? And when you're thinking about systems change and when you're thinking about advocacy at the global level, you can think about it in a couple of different ways. You can go, all right, well, we need to make our own home. So we don't really belong anywhere. Let's try and build it. That's actually really difficult because you can imagine trying to build infrastructure and have, say, a cerebral palsy resolution, which we are trying to drive for, means that you're trying to then create a system that doesn't really belong in the current framework.
Right.
Or you then go, okay, we're going to go into a kind of current framework and let's pick one. But if I only pick one, then I'm really not considering, as you said, even in adulthood and other things, like these other elements of CP.
Yes.
And I think we almost actually start having to embrace the complexity.
Yes.
You know, in research a lot, you'll see actually we try to, I suppose, decrease the complexity because of how clinical trials need to be built.
Yes.
But when you're doing that, you're missing the full picture of cerebral palsy and the community particularly. So how can we get clever in actually embracing our complexity? But again, it's not a simple solution, but it's one that I'm really excited to keep exploring and to think about how as a community, as I said, rather than trying to make it remove barriers, almost like creating it as our North
and using
Star.
that as our strength instead, right?
Exactly.
Well, you do need to do that. And as you're saying that, I'm thinking about how I can really see in the mind map. You know, when we do presentations, you go, all right, the child of the family is cerebral palsy in the middle. And these are all the people that are involved. And it becomes this massive web. And I'm like, of course, it fits everywhere and therefore nowhere. But then you look at what the solution of that might be. Again, very complex because there's so many people involved. And it's also important for the well-being of that person, and it's different for every single child and family.
Yeah, absolutely.
And complexity,
but I think, you know, we're not the only condition like
of
this,
course.
right?
Yes.
And I think that's where we need to lean into other conditions who have done this well.
Yes.
And it was interesting. I was talking to a lot of people after the adult special interest group yesterday. And it was that same sort of thing going, okay, adult healthcare is obviously very different from child healthcare. So does it make sense to have a cerebral palsy complex care clinic for an adult? Or does it actually make more sense to lean into how the adult system functions? And so like there's all these different things that I think we need to do more of. So it's like if you're thinking about adults, it's like, okay, should we be positioned at cardiovascular conferences because we know, adults with CP, probably about 50% of them will have cardiovascular issues, but only about 10 or 15% are now getting any intervention.
Wow.
This gap of need to actual what is happening is so huge. But again, it's that whole concept where we could create our own.
Yes.
But is that going to actually work, or do we need to lean in and think about where else we could be partnering and belonging?
I know you spoke yesterday about yourself and John presenting at a conference to a number of doctors and physicians, I think in Europe, was it, where you were educating them about what CP was and just like their potential, didn't know a lot about it, yet they're probably seeing a lot of clients with a diagnosis of cerebral palsy.
Yeah, it comes back to, how someone looks at cerebral palsy and what it even is. I think some of the data is so interesting in that regards when you can go, all right, I've got a child that comes in and I'm going to give them a diagnosis of cerebral palsy. Someone else might see that child and be like, oh, no, they've got epilepsy. Or, oh, no, they've got a developmental disability. Or they might even say they've got hemiplegia.
Wow, yes.
Right? And so what we're seeing across borders particularly is this differences in approaches. And that can be good and bad because I think phenotyping obviously is really important in moving things forward. We don't want to lump everybody together. But when we don't come together, it means, again, we're sort of all these different conditions that don't then have this sort of groundswell of support behind them. And for families, that's the most important thing, right?
Yeah.
We've done so much work with families.
Yeah.
They actually like knowing that they're part of the cerebral palsy community. They feel like it does belong to them, right?
That's right.
We don't want to take that away.
No.
There are a lot of challenges. And I think knowing what the challenges and the barriers, as with all good research, you want to know what the barriers are. You want to know what the challenges are because then you can develop an action plan around it. And I know this is something you think deeply about. What are some of the things that you are really excited about and trying to move forward to try and address some of these challenges?
Yeah, absolutely. Anyone that knows me knows that I've got probably 15 things going on at the same time.
I love that.
Action is, I'm too impatient to not actually
it's a good
see
feature.
things move
It's a
forward.
good feature. Yeah.
Look, I think when we're looking at all of this work, creating capacity for people to take action is really important. One of the things that we hear so often is, oh, I just don't have time, or I'm doing this after hours, or I'm doing this as a volunteer.
Yeah.
So how do we create within our own structures that next step for people?
Sure.
And I think some of that means going, okay, very simple things. All right, if you've got a network, you're funding a coordinator, like a research network, right? Make sure that coordinator is actually funded because they are going to be your cornerstone of all the work that happens. If we're thinking about like these broader advocacy efforts, making sure we're actually all coming together. Last year we launched CP360, which is a collaborative effort between Cerebral Palsy Foundation, Cerebral Palsy Alliance, and International Cerebral Palsy Societies.
Amazing.
With the whole sole purpose of actually being able to say, let's bring ourselves together under a single vision and mission.
Wonderful.
To work together for these goals.
Yeah.
And I think sometimes it's also just doing that.
Yes.
It's very easy to continually have ideas.
That's right.
And then talk about them, which is wonderful. But actually thinking about, well, what's the infrastructure that you need to build so that action can actually happen?
That's beautiful. Because otherwise you get replication, right?
Yeah, absolutely.
And that's in terms of resource allocation. You don't want to have 10 coordinators when you could have possibly less, but have the same streamline or goals or vision. Because if we have research initiatives, we also want to be on the same page and tackle it strategically together rather than chipping away at it, which takes longer.
Yeah. And I think that's why things like CP360 is so good. That is built upon a strategic roadmap.
Yes.
And when you have these roadmaps, you can take action. And the good news is, and I think this is what some people are scared of, by taking action, it doesn't matter if you don't have all the answers, right? You can fail. And I love this. Dave Dame is someone who we work with closely. He is an innovator at Microsoft, but also has cerebral palsy. And he always talks fail fast.
Yeah.
Right? And that's something sometimes that we're scared to do.
That's right.
We're scared to sort of take action because what if we don't have all the answers yet and then it's not going to work? That's totally okay.
We'll learn.
But build it in.
Yeah.
Right? And build it in with going, it's all right to have that critical kind of thinking sometimes and leave it behind. Now, that's sometimes really hard in research, right? Because that's not necessarily how research has been traditionally done. We all hear the statistic that takes 17 years for something to be developed in research and get to clinical care.
Yeah.
In the day and age that we're in right now, 17 years is just mind-blowing, right?
Yeah.
That's a
think
whole
of how much
generation.
technology.
That's a whole generation that has potentially missed out on an opportunity for growth and development.
Absolutely.
And so I think about it that way and I'm like, well, we can't wait 17 years. No. And what we got in the habit of doing, though, was there are some research frameworks that do take a long time. But that doesn't mean everything needs to take a long time.
That's right.
And so you've got to balance those things out and go, all right, let's build it to be agile. Let's build it with that mindset.
Yes.
And keep
and I
things
love
moving.
that. And I think there's some great examples that we've heard at this conference as well. Early detection is something that has happened quite quickly. Like, for research to come into practice, it's quite a fast timeline. So even just looking at, examples that we've had before and how can we keep building on that?
Absolutely. That's definitely a model that the foundation has taken on full throttle. So when I think about the early detection guidelines being published in 2017 and that international working group, the fantastic thing about that group, though, is that they did actually create a roadmap.
They did.
And so in that moment, and you think it's been 8 years, we now have, like in the US particularly, we have about 30% of high-risk infant follow-up now following those guidelines.
Wow.
That's pretty amazing uptake in that time.
Yeah.
But that didn't happen by chance.
That's right.
That happened through really considerate and purposeful steps. Now, I'm not going to say that they were perfect the whole way. We have learned so much and made mistakes and gone back and revisited how to do it. But we were able to, because of Dr. Natalie Maitre, who was actually at Nationwide Children's Hospital at the time, those guidelines were published and she implemented a framework the next day for the Hammersmith Infant Neurological Examination.
Phenomenal. Yeah.
And then within 9 months, we had a network in the US that were implementing it, right?
Yeah.
And so then from that, it got published. Then international groups were able to come on board and do it. Then we've now got models that hopefully the AAP is going to endorse. Like, these are sort of the steps to this sort of rapid implementation that I think is so important. And we should be doing the same model for everything else. Why don't we do it for adults? Why don't we do it for breakthroughs?
Yeah.
We haven't spoken about breakthroughs, but that's something that I'm just so passionate about because
let's talk about that. Yeah, let's go.
As a field, we had breakthroughs in the 60s and 70s, right? Really interesting. Rubella vaccination. Something now that tens of millions of people globally has prevented cerebral palsy and other disabilities, has saved so many lives. We had maternal blood type incompatibility with the rhesus vaccination. We had things around treating jaundice. Like, these were pretty monumental breakthroughs that really did huge things for global health.
Yeah.
What have we really had over the last 30 or 40 years has been far more incremental in management. And these things are super important. I'm not going to say that, participation and focus, obviously, on all of these other social constructs absolutely need to get done as well. But cerebral palsy as a pipeline through basic science to actual what would be a breakthrough intervention, there isn't one.
Yeah. Wow.
And if you don't have that part started, you can't expect then that all the other pieces are then going to fall in place as well. So, these are the things that I think we need to be thinking of as a field. Like, how do we, rather than prioritize one part over another, how do we actually bring it together in this sort of really wonderful continued process?
And I love that you put it up there, because you've got to put it up there to start that conversation, to bring people together, because even in just this conversation alone, I'm sure everyone that's listening as well is thinking about the how element, that how do we make this happen, and feeling the sense of impatience as well to move forward. And
you can feel overwhelmed, right? You can go, oh my gosh, this is such a big piece to bite off. Like, how are we possibly going to achieve this? But, we're really good at solving hard problems. That's what this field is the best at.
Yes.
Every single person here solves pretty complex problems every single day.
Yeah.
It's just then applying it potentially on a bigger scale.
Yes.
And as I said, coming together intentionally about it as well.
That's what I loved hearing yesterday when you're talking about CP360 and these different global organisations or, from different areas around the globe coming together And you were so strategic because you were all mindful that if we were going to use our time and come together, we wanted to be specific, we wanted to be targeted. You spoke about these global working groups with a real particular focus. And I think, why not come together? Like, let's just get this going. You talked about the beauty of clinical guidelines, having a roadmap, then we can bring it to implementation. And one thing I loved was talking about things on a global policy level, because that is ideally how we're going to get recognition for the CP community and have a bigger impact.
Yeah, absolutely. You know, global policy is a minefield in itself. And I've definitely, I'm not the expert on all of it, that's for sure. But it has been a really interesting learning curve. And, you know, one of the pieces that we realized was that at the global level, whether it was at WHO or UNICEF, cerebral palsy wasn't at the table. And so if you're not even at the table in these conversations, you know, unfortunately, no other group is going to put their hand up and say, hang on a second, cerebral palsy is missing. You know, we should invite them. And it's not because they don't care. It's not because they're also advocating so hard for those different pieces, right? And they've got to stay focused on their work. And I think that has been a huge shift in actually going, all right, let's have cerebral palsy recognised and at the table. And when we're at the table, what are we asking for? And again, we're not asking just for something that's incremental. We're asking for things that are really going to change the outcomes for families and obviously children and adults with CP around the world. And when we think about global health policy, you've got to go, okay, WHO is kind of at the center of that. And it's a really tricky time right now for, you know, global funding and global health policy. But they have frameworks that we can lean into rather than just going, all right, we're going to create our own. And you can do grassroots efforts where you're sort of doing that bottom-up approach. But that top-down approach is also really important. And I think they're the things that we're sort of juggling right now to have visibility in those spaces. And then move it from visibility to actually action. And then now hopefully then taking it to what would then be almost mandates, you know, across global health ministries.
That's right. And so on that, when it comes to the research efforts, which there's a lot of research efforts that we hope to improve outcomes and impact, but there's a lot of research happening in all different directions as well. What would your thoughts or your most ideal scenario be if we're going to come together? Because yes, coming together is important, but how do we do that when funding streams to get grants are so tricky? I mean, it's a minefield sometimes, isn't it? But how do we come together? What are some of your thoughts on that?
It's a really interesting question, because I think with the funding models that we currently have, some of them don't encourage that, right? Which is part of the problem. But one thing that we did at the foundation about 7 years ago, so we've been around for 70 years and we've probably given around $150 million out in different research grants over that time.
Wow.
And when we actually looked and sort of did a review, a lot of it was like, okay, were these incremental pieces, or did this actually create a pathway for future work?
And
I think the piece that we then realized was, rather than giving small research grants to individuals, we now do it all through what we call networks of change. And so individuals can still get small research grants, but then they're embedded in a much larger ecosystem.
I see.
And so that's really important. You still need early career grants, because we absolutely, and this is like a call to everybody, we need to have a pipeline of young researchers and clinicians coming into this field.
Absolutely.
Because we are an aging field, which sounds terrible, but it's true. So I am a full advocate to make sure that those pipelines exist. But actually, by thinking things around a network approach, network approaches allow you to solve these bigger problems. It allows you to bring in different elements of funding. So whether it be industry funding, whether it be obviously government funding, which is the backbone of most of the work that we do, private philanthropy, community-based funding. And by doing it sort of in these manners, it allows it to move forward. I think the trickiest thing for some of the research work is, you know, when you're looking at grants will encourage you, obviously, to put your best foot forward. So they become so competitive, even though they're like, oh, actually, but can you collaborate with somebody? But then you're also competing against the same space. So by nature, actually, academia doesn't really support that model.
No,
but I think that's where organisations like the Cerebral Palsy Foundation, where CP360, if we can create these sort of almost networks that aren't competitive, we can hopefully then bring all those pieces together.
And that common goal, the common vision.
Exactly.
And that then supports bringing cerebral palsy to the table.
100%.
Yeah.
And that will bring more funding in so researchers can do the work that they need to do. You know, it's not saying that individual research or individual ideas don't then still belong to that researcher or that institution. It's just saying rather than having 10 institutions doing the same thing, can we have a more cohesive conversation around it all?
That's brilliant. So you've spoken about increasing capacity, talking a little bit about research in terms of some action plans. What else have you got in mind?
Oh my God, what else do I have in mind? You know, I think the bit that I would really love to see is this change in mindset when it comes to CP.
Okay.
You know, I think, and I've been here where we're so grateful for anything that we go, okay, like, thank you for that.
Yeah.
And we're kind of almost apologizing for the help, right? Like it's, and I want to switch it. So our mindset goes, actually, we're going to be unapologetic in saying that we need this for cerebral palsy. By the way, what we need isn't small. It is large. We deserve to be at this table. We deserve to take up space as a community.
Yes.
And, you know, how do we get there? And that, I think, comes from this belief that we belong.
Yeah.
And I would love to see that happen for CP because I just think, you know, these families deserve it. These children and adults deserve it. And, you know, we can't wait.
Yeah.
Like, yes, I'm just naturally impatient, but the urgency doesn't come from me wanting to create systems of change. The urgency comes from meeting families. The urgency comes from meeting children.
Yeah.
You know, it's so interesting. I was part of the Queensland CP Child Studies. Those children were 18 months at the time, and we travelled around Queensland and met every single family who was under the age of 5. They're now 18 and going into adulthood. And I can tell you, we know that those same children are not going to have supports that they need, are not going to have research frameworks to prevent, you know, early onset morbidities and all of these different things. And so that's what matters. It's those families, those adults, those children who are like, do you know what? They can't wait for us to get our act together.
Yeah.
They need it to happen today.
We got to do it. So how can people get involved? You know, there's lots of, when I look across the room right now, you've got lots of different organizations, people that work privately, or from all different walks of life, trying to support this area, I suppose, in the work they do.
Yeah.
How can they get involved, apart from being part of these research collaborations potentially that have that vision?
Sure.
What does that look like? And what can you encourage people to do?
No, I think it's also like organizing yourselves in a strategic way. And again, that doesn't have to be one organization who, you know, organizes all of it. It's just if you are, say, a solo therapist or you are doing different things, who is your network around you?
Okay. Yeah.
And in that network around you, what activities are actually getting done? And again, not just by chance because, you know, you've done some good work and it's sort of flowing on. How do you then strategically mobilize? And that's why it's really great things like at the Oceania Academy where you have special interest groups.
Yeah.
You know, you have these areas where people will mobilize around specific things. I think if you want to get involved in all the global activities, any of our organizations would say, yes, please. Absolutely. Like this is an open door for collaboration. It is absolutely not shut. It's not for just a certain amount of people. It really is something that we know it's going to be far more than one person, far more than one institution, right?
Yeah.
I also think if you're thinking around going, well, I just don't have time, like this is too hard, I'm struggling even to just do the work that I'm doing, try to think about the work that you're doing still within this larger strategic piece.
Right.
Don't see yourself still as this individual pathway. Go, oh, actually, this is part of a larger strategic vision.
Yeah.
And even just the recognition of that, I think is really important.
And that's really a mindset shift, isn't it?
It is.
And that's what we're hoping for in this, is that we're not doing this alone. There is a bigger picture here. And from that, I don't know, when you have a change of mindset, opportunities come.
Absolutely.
Because you're open to seeing it, right?
You're open to opportunities.
Yeah.
You're open to things not necessarily working out, but you're going, all right, we're going to do it again. But that's also part of the process. It's not seen as, okay, that's a failure. Now I'm kind of blocked and I'm stopped. It's actually just seen as this continuous movement and things happening.
Can we end on a big question?
Sure. Love a big question.
I'm intrigued.
Vision. What would you like to see? 10 years, 20 years down the track, what would you like to see? Yeah.
Okay, so these are going to be pretty bold.
I love them. I love it.
In 10 years, I want to see two things. I want to see preventable CP through disease in low and middle income countries actually being recognised and having specific action against it.
Wonderful.
If we know that 85% of cerebral palsy in those countries is preventable, and I'm not talking about eugenics, I'm not talking about termination, I'm literally talking about a child getting an infection, preventing that infection.
Yeah.
Let's get back to basics.
Yes.
Yeah.
In 20 years,
staggering statistic.
In 20 years, what I would like to see is cures with an S. Right?
Wow.
We know if we're thinking about etiology and phenotyping of cerebral palsy, whether it be through genetic pathways, whether it be through other viruses or those different things, if we can't prevent that part from happening, how do we look at actual cures?
Yeah.
And that is interventions, and that could be across the lifespan.
Wow.
Right? Why not?
Huge. Why not?
Why not?
Yeah.
Why not think about what a stem cell therapy or cell-based therapy is going to do? Why not think about repurposing of pharmacological drugs? You hear about it all the time in cancer. You hear about it all the time in other areas. We're not doing any of those pieces. What about therapeutics for actually babies and infants in the NICU? Do you know that there's only 2 approved drugs for the NICU?
Is there really?
That's it.
2.
And that pipeline and pathway is, everything's getting used off label, which is obviously pretty common, but that pipeline and pathway doesn't exist.
Wow.
And again, why has that been?
Yeah.
I think it's been in the belief that, this is something that can't be cured.
Mindset again.
It's mindset.
Yeah. Yeah.
And if we believe that, then we're never going to create a pipeline or a pathway of opportunity. But, I can tell you with all the adults that I work with and the adult CP community that we're so close with, they're not scared of that word.
Yeah.
Right? Because life can be really, really hard.
Yes.
And it's like, why aren't we trying to advance science and medicine that is, by the way, happening in all these other areas for cerebral palsy as well?
Oh, I love that.
Yeah, me too. I was just staring as you're speaking, just thinking, wow, all these things, like there's so many. I just want to keep chatting to you, but it's exciting. But you're right. We have to drive for it. And
they all work together. I think this is the piece, right? So, yes, we've spoken about so many different things today.
We have.
But actually, that creates this pretty amazing roadmap of progress.
It does.
Right? And so this is the whole piece. It's not everybody doesn't have to be a basic scientist and understanding, cell-based therapies and the neuroscience of that and the biology of it. I definitely don't. Right? But doesn't mean that we can't get other people to come in.
That's right.
And so it's more around this sort of vision and roadmap and those different pieces. To me, they're all incremental steps to make this change happen.
That's beautiful. And look, at the end of the day, you need a vision to know where you're going. So why not make it be bold? I mean, if we're on the goal attainment scale, everyone, this is a +22222, right? We always say the +2 needs to feel like a little bit sick inside. We go, really? It has to be much greater. And I think you're so right. Like, Rachel, as you're talking about that, I know we're trying to come to a close, but it was only about 8 years ago, and just my clinical experience, right? We were like, all right, families kept saying my child classified within GMS level 4 and 5, but they really want to be up on their feet. Yeah. And it was funny that about 10 years ago, it was kind of like, oh, why would you get them on their feet? Like they're meant to be they're going to be in their walkers. Do not sell false hope was always the thing.
Yes.
But then we could position them really well. We're getting 2, 3, 4, 5-year-olds into their walkers and they were loving it. And when we first tried to get the work published, it was like, why are you putting children in walkers and putting them on their feet? They're GMS level 4 and 5. It took a while to get it published. But the families are really wanting it. And now it's become our everyday. Yeah. And now it's like, this is what it is. But that's a small example of just doing something a little bit beyond what the norm was, safely, but just thinking a little bit differently. And now it becomes the norm. So that's what you want,
I love
right?
that you did just use the word safely, because everything that I've discussed today is not about being ruthless in our approaches or being unsafe or thinking
reckless.
about, you can be big and bold and do it in a way that is still, maps with all of those things.
Yeah.
But, I love that, right? Like I even think about 5 years ago.
Yeah.
Right? What we were doing 5 years ago and what we understand now, what we understood 2 days ago when it came to AI. So it's like totally extraordinary compared to what it was. We had that AI talk and you're like, wow, okay. Yeah. Look at these models of research that we can develop that we didn't have.
Right. Yeah.
Even 12 months ago. And so it's like they're the sorts of things
that's going to evolve
that are exciting.
And that's the exciting part about being on the like keeping up to date with the evidence is important. And Diane Damiano also say this, like, I want to keep up to date because then when the next big thing comes, I'm ready to step in.
Absolutely.
It's not this big gap to go, come on, come with me. Like, let's just do it now. Let's get ready for that next big thing. And let's wait and see. And
well, maybe we can end on a quote because one of my favorite quotes in the world is by Maya Angelou. And it's one of those things like, you know, we do the best we can until we know better. And then when we know better, we do better. Right?
Beautiful.
So this whole conversation is not saying that everyone isn't doing the best that they can.
Yeah.
Absolutely. Like as I said here earlier, everyone is phenomenal as part of these organizations. You know, we're all here for the right reasons.
That's right.
But when you know better, do better.
Yeah.
And, you know,
organize
and don't wait for that.
Yeah.
So, you know, that's something that I suppose is a quote and a mantra that plays in my head constantly.
Hugely inspiring. See, I told you all this was going to be a very, very good, inspiring talk.
Rachel, we need to talk again.
I'd love to. I'd love to talk anytime. Everyone who knows me knows that I love a chat. So
what you say is so inspiring and so encouraging. And thank you for leading this, I think. You know, thank you for driving and inspiring.
Thank you both.
We're on it.
Both. It's been a lot of fun.
Wonderful. To all of our listeners, hope you really enjoyed that. We'll pop links of all this information on researchworks.net, on researchworks.academy as well. This is something we all need to know about and keep up to date with the latest information too. So thank you very much, and we'll talk to you all again soon. Bye.
Bye.